What kinds of treatments are there to eradicate SIBO?
Yeah, there are basically three treatments that can be used and three options that studies have shown are effective. The first option is the pharmaceutical route, basically using antibiotics. There's one specific antibiotic that is especially effective in treating SIBO. It's called rifaximin or Xifaxan in the US. And it's really actually kind of a unique antibiotic. It's designed to kill bacteria in that small intestine. It crystallizes once it reaches the colon. So it's not hard on the good flora, the beneficial flora that we worry about so much when we use other antibiotics. That's huge, right? It's relatively safe. It has a relatively good side effect profile, and it's effective in treating SIBO. The only caveat, well, a couple of caveats, it can be quite expensive, and we try to get it run through insurance, of course. And sometimes we can also source it from a Canadian pharmacy or an international pharmacy if needed. But that is sometimes an obstacle. And then when someone has the IMO, the intestinal methanogen overgrowth, we also need to add another antibiotic. It's a harder SIBO to treat, generally speaking, and rifaximin on its own isn't as effective as we would want to treat this type of overgrowth. So we either add neomycin or metronidazole. Other antibiotics can be used. It's just that these are the ones that have been linked to better, efficacy in treating SIBO. So the pharmaceutical route, and that would be like a 2-week treatment usually.
Okay.
The second option are the herbal antimicrobials, and we're basically using herbs to treat the SIBO. It is effective. It's usually a 4-week course versus a 2-week course, I should say, and pretty heavy duty use of certain herbs 3 times a day for 4 weeks. I also use this option quite a bit, and there are a lot of herbs that can be used. And I can tell you which herbs that I find efficacious, and through a lot of communication with SIBO experts and colleagues, these are the ones that have been found to be pretty effective. But I usually use berberine and oregano for any sort of SIBO overgrowth. And then if the methane producing bacteria are present, it's important to add allicin, which is, the antibacterial component of garlic. So those herbs work well as well. And then there's the third option for treatment, and it's known as the elemental diet. And this is just drinking a formula, no other food for about 2 to 3 weeks. And basically that solution or the formula is an easily digestible formula that gives the body all the nutrients that it needs in a really simple form. So it's readily absorbed quickly. It leaves no food for the bacteria, and you starve them to death.
So do you drink the solution? How much of the solution do you get, like, really hungry?
That's
And some people are underweight when they have SIBO. So will they lose more weight?
Well, the idea is that you use their basal metabolic rate, and you figure out how many calories that patient needs to sustain their weight. So there's ways to work around it. You would just increase or use the amount of calories needed for that individual person.
Okay, so they will need to eat the amount of calories that they are supposed to be eating in that solution.
Yep, exactly.
So do you take that solution for 2 weeks or 3 weeks?
It's either a 2 to 3 week course. I think It just depends on the severity of the SIBO, what I would recommend for that individual patient, but it can be 2 to 3 week course.
It's been said that 1/3 of SIBO cases are resolved and 2/3 are chronic. What are your findings on that, and how do you treat chronic SIBO cases?
Yeah, I have heard that same statistic that 2/3 of cases are chronic, have been going on for a long time, and also those are the cases that more easily relapse, and we have to be really careful about that as well. In my practice, I tend to see more of the chronic cases, and that's just what I've seen clinically. But there have been cases of acute SIBO where usually the symptoms have been going on for a shorter period of time, and usually one course of treatment can treat that acute SIBO case. And then the chronic cases, generally I use more than one course of treatment, and I let patients know, don't be disappointed if we do a course of treatment and we retest and your gas levels are still high. That's generally normal for that 2/3 of cases, right? Where we need 2 or even 3 courses of treatment to really eradicate that bacteria, and get them to a place where they have a negative breath test. But I'm sorry, I forgot your second part of the question.
Oh, well, so how do you manage then the chronic ones that that they're gonna relapse every 3 weeks, 4 weeks? It depends on the person. Um, do you have a strategic plan for them not to relapse?
Yeah, yeah, that's such an important part of treatment. So like I mentioned, it sometimes takes more than one course of treatment, and I usually have about a week or 2 weeks between treatment courses if they're going to go on to need another course of treatment. And it's important in those interim times for them to be on something called a motility agent or a prokinetics, kind of the same thing. Um, and what that agent is going to do is help that migrating motor complex work better, right? So, like we mentioned, that MMC is crucial in making sure that it's working properly and sweeping that bacteria out of the small intestine. So I'll have someone on a motility agent in between treatments. And then it's also known that chronic cases, it's very common for relapse to occur within 3 months of finishing treatment. So I make sure that when we finish treatment and the SIBO has been eradicated, that patient's on that motility agent for at least 3 months. Is that like really risky time period?
Yeah.
Yeah. And and I'll also let the patient know that that MMC is working more in a fasted state. So discrete meals or meal spacing, not snacking all day, is important, because when we go 4 to 5 hours without a meal, it's that MMC gets to do its job and sweep bacteria out. So the patient needs to be aware that meal spacing can be beneficial. There are also a few other variables to think about. I mean, one being, like we mentioned, right, root cause. So if there was a root cause to the SIBO, we make sure we're addressing that as well, whether it was lifestyle or some other condition that put them at risk for it. We need to make sure we're also treating that and addressing the root cause, obviously. Yeah, so important to not just focus on the treatment, but also focus on them not relapsing. Exactly.